Nebraska News Service.
I love my country. I served in the Air Force for nearly 30 years, 16 assignments, deployed 4 times. I had 5 commands. I love our country. We're the land of the free. We're a land of opportunity for everyone.
2016, my mother was diagnosed with cancer for the 5th time. And growing up, it was just me and my mom. So it was a rough journey. But that year, she was prescribed a $2,500 pill that she couldn't afford to take. And it just rattled me and my family to our core that a pill in the United States of America, that a pill could cost that much, especially for a woman who had Medicare, who was dying of cancer. And I made the decision that I didn't want anybody to have to go through what my mom went through.
And so we need to get the vaccine out, therapeutics, and make it safe for people who want to go back to travel and doing the things they were doing, so we can get back to that great spot where we were at. Here's another stat, the lowest poverty rate in the history of our country, 10.5%. It was going down. So I want to get back to that.
Well, Congress has to, hands down, focus on COVID relief. That means saving lives, saving jobs, getting our economy back on track, getting people back to work safely, and getting kids back in school.
I favor a free market, more approaches to our healthcare to drive down costs. And I don't want a government one-size-fits-all healthcare plan that takes away your options and your freedoms.
I talked to a man the other day in the district who's on Medicare who said that his prescription costs went up 57% since the pandemic hit Nebraska. That is outrageous, and people can't afford to take the medication that they need. So that, to me, is the first step. Then we need to start looking at how we change our current healthcare systems. I think one of the things we've seen in the pandemic is that people now are starting to understand even more that coupling employment with healthcare can be pretty precarious, especially given the numbers of people who have lost their jobs and therefore lost their healthcare recently.
I believe you have to maintain qualified immunity. A lot of people don't know what that is, but qualified immunity is if you followed the law and followed the procedures of the police department, you can't be sued. Now, if you violate the law, violate the procedures, you can be sued. That's why it's called qualified. If you don't give qualified immunity to cops, they'll be sued for traffic stops, doing their job day in, day out, and they will get out of the police, and you won't be able to recruit. It's another way of gutting the police department, getting rid of that. My opponent supports getting rid of qualified immunity, and so does Speaker Pelosi, and I think that's a mistake. We need a good law enforcement to protect us. There's bad people out there, and we want policemen to protect us, and you got to have quality people.
Law enforcement officials who now are working with kids in the community, teaching them sports, playing sports with them as a way to connect. And I think that could be a model for the country. And he also talked about investments in mental health. My first job out of graduate school, as a social worker, I worked with a police department to create a domestic violence program. And what we saw was that by working together, by actually making sure that they had social work resources and mental health resources, that we were able to reduce crime in a neighborhood by about 90% with wraparound services.